Good morning, everybody. My name is John Skibiak. I'm the director of the Reproductive Health Supplies Coalition, and I'd like to welcome you to this webinar on the 2018 Global Commodity Gap Analysis. As many of you know, this gap analysis was launched at our general membership meeting back in March. The co-authors of this study, Nina Miller and Michelle Weinberger, gave a short introductory presentation on a panel that was hosted by Mindy Sibilia of CHAI, but insofar as they were one of probably 5 presenters during that panel, their presentation was fairly short, but the feedback was very positive. In fact, so positive that we decided to follow up with a series of 3 webinars. This is the first. Next month, on the 10th of July, we will be hosting a second webinar that takes a deeper dive into countries in Latin America. It'll be a webinar in Spanish. And then later in the month, on the 24th of July, we will have a webinar focused on the needs of advocates in the advocacy community and how advocates can use the data that's contained in the study. We'll also soon be launching an online dashboard that will allow viewers to be able to identify which countries or groups of countries they're interested in looking at in terms of the data that's available in the gap analysis. And we've also produced and will soon be releasing a collection of fact sheets that, again, take a sort of deeper dive into groups of countries. This gap analysis is actually the 4th gap analysis to be published under the name of the Supplies Coalition or its predecessors. The first was in 2001, another one in 2009. But this is the second in a series really whose genesis can be traced to an SP 2020 reference group meeting that took place in Delhi some years back, where the question was asked, what is the gap? We talk about reaching 120 million by 2020, but what's the gap? What funding is needed to be able to achieve that? And so we sort of took on the responsibility of figuring out that question. And we started by reaching out to the reproductive health community as a whole. And what we learned as we reached out to the community in terms of their interests with respect to the gap analysis is that really the interests were quite broad. The donor community often has an interest in knowing what the public sector is going to ask of them and what the value of that ask is likely to be. Innovator manufacturers are often interested in knowing what the donor community is likely to request of them. Generics are often interested in the global market and the opportunities that presents. So we found through really a broad consultation with the community at large that the interests in the gap analysis were really quite broad. And so in 2017, when the first of this new series of gap analyses were produced, we began to sort of cast the net fairly broadly. We didn't just look at the low and middle income countries, which have been the focus of gap analyses in the past, but we also did a sort of deeper dive and looked more closely at the 69 SP 2020 countries. We also looked at the total market, not just the donor market, which again had characterized the work of earlier. This report, the 2018, carries on that tradition. It looks at the total market, but it also builds on and tries to look in greater depth at some of the issues that arose during the 2017 analysis, particularly the segmentation between the gap and commodities that are procured through funds from the donor community, through funds out of pocket, and through country derived funding as well. In the coalition, we always strive to leverage the power of partnership, and that's as true of this study as it is of the coalition as a whole. We rely on the support of our core donors who provide the resources that have allowed this study to take place, and that includes DFID, the Bill and Melinda Gates Foundation, USAID, and UNFPA. But we also rely heavily on the technical support of our partner agencies and member organizations, Avenir Health, Track 20, the UN POP Division, NEEDY, FP 2020, ICVIA, CHAI, JSI, Guttmacher Institute, the list can go on and on. But all of these partners have played a key role in helping guide us in the way we pursue the objectives of this analysis, and in many cases actually providing the raw data that we used in conducting the study. So before I turn the floor over to the authors, I'd really like to encourage everyone to share their thoughts and ideas as the presentation goes on. And I'd like people to share their thoughts and ideas both about this analysis that you'll be hearing in greater depth, but also people's thoughts and issues that you feel we should perhaps pursue in the next iteration of this analysis in 2019. I think one of the things that's clearly becoming clear, especially as we're approaching 2020, is that eyes are focusing on the period after that, and particularly in the run-up to 2030. And so the reproductive health landscape, the financing landscape for reproductive health commodities is becoming particularly of interest to the community as a whole. And I think this is a good opportunity for all of us to begin thinking about where we go and what people would like to see in the next analysis. To facilitate that, we've put in place sort of two options for people to provide feedback. One is the little box on your screen where people can enter comments and questions. I encourage people to do that as they're listening to the presentation, so we don't have that uncomfortable gap in between the end of the presentation. We wait for the first questions to pop up. So please feel free to start writing questions and inserting them as the presentation is going on. And for those who have difficulty condensing complex thoughts into short sound bites of 10 words, we're also going to have the option of people raising their hand, and we will unmute them afterwards so people can ask the questions directly. If by chance we should end up with some questions that we're not able to answer, we will follow up with you, and I can give you an address later on during this presentation. So you can either send questions in, or certainly those who've written their questions in the text box, we know who you are, so we can follow up directly. So really with that background, I'd like to turn the floor over to the two principal authors of this study, Nina Miller and Michelle Weinberger.
Great, thank you, John. This is Nina Miller, and I'm so happy we're able to share the latest iteration of the commodity gap analysis, or the CGA 2018 today. John, you spoke about the background to this project and previous reports, and before Michelle gets started, I'd like to say a few words about our specific objectives for this report. The immediate objective of both the previous CGA report and this one have been to estimate the disparity between the cost of the total volume of supplies that users of all modern methods of contraception will require for their personal consumption, and the total amount of funding available to pay for supplies from all sources. And that's how we define the gap that we're talking about in the global contraceptive commodity gap analysis. We're doing this to help inform discussions about future funding levels, manufacturing priorities, program strategies, and advocacy efforts. And we're adding detail and nuance with each successive report. In the last report, we addressed the 4 questions that you see on the screen. And in the new report, we revisit these questions, making use of new data, especially private sector commodity price and volume data that we purchased from IQVIA, and improved methodologies that reflect suggestions from different partners. This report also has new analyses we weren't able to provide in the last report. They include exploring method use, cost, and spending in the public versus the private sector. And they also include the beginnings of our analysis of the differences between users of contraception who live in extreme poverty versus those who do not, and who obtains their supplies and for what methods in the private versus the public sector. And we're doing this because we're adding those new analyses because, as we all know, it's a perilous climate for international assistance. And the assumption that the number of users of contraception will continue to grow while donor support levels off or declines may depend on shifting user consumption and cost to the private sector. And what we're finding is that the landscapes of what supplies are available in the public versus the private sector can be quite different and may really complicate these efforts. So I would just like to finish up by saying that the CGA's approach is global. It comprises 135 low and middle income countries, but it does not use a top-down approach. It has a user-centered methodology that builds information from the country level up. So even though the findings that Michelle is going to present to you are global in nature, we arrived at those through an enormous number of calculations and estimates that are currently hidden, but we're happy to share with you. So as you listen to Michelle, please think of questions you have and what estimates we could provide to you that are more granular than what we're talking about in this webinar. And of course, any thoughts and suggestions you have for the next report.
Great, thanks, Nina. So before we get into the results, I just wanted to pause to say a little bit more, building on what Nina just said about the kind of all of the data and the different methodologies that are feeding into getting to these numbers. So first, as you can see in yellow, that we have a huge number of data sources that are feeding in, and John has already thanked all the great number of partners who are contributing data to these efforts. And this year we updated all of these data sources, so we're making sure that we're relying on the most recently available data for all countries in order to kind of get the best picture of what things look like now and what we think they will look like into the future. And then, as has already been noted by both Nina and John, we also this year added some new data sources and new approaches to give us better insights. So first are the price and volume data, which we purchased from IQVIA, which we'll look at in a moment. We also use social marketing data, which DKT compiles to give us a better look into that sort of hybrid market of subsidized goods that might be coming through the private sector, but sometimes have a subsidy to them. We had a survey that RHSC conducted in last, which gave us new insights into government spending on family planning in that region, which was a big gap in our previous work. And then this analysis that Nina touched on about poverty, which we'll revisit at the end of the presentation. So this graph shows the data that we purchased from IQVIA about the average price. We were able to get data for 3 methods: pills, injectables, and implants. I know it's a bit small here, but in the report itself, if you look at page 33, you can see this in much more detail. So I'm not going to go into too much detail, but wanted to point out a few observations. So first, we see a huge amount of variation across all three methods in the prices paid in different areas. So you see that the height of the bar varies greatly from where the unit cost is most expensive to where the unit cost is the cheapest. And that generally we see higher prices in Black and Eastern European countries. We also find that in almost all instances, the prices that we are using from IQVIA, are higher than the donor prices, which are shown in that yellow line. So one thing I do want to point out is that we know that these prices are not strictly comparable to the donor prices, because in the donor prices, we're really looking at kind of just the price of the commodity, whereas in the private sector, tied up in that price of the commodity is sold to clients that are other additional costs. But we really wanted to use this because we wanted to think about the barriers of accessing commodities in these two sectors, whereas in the public sector, the need and the barrier is really the cost of governments to buy those commodities, whereas in the private sector, it's really ultimately the cost of a client to be able to go and purchase the commodities. But we also know, as I mentioned before, that the private sector has a lot of variation in it, and that these prices may not be reflective of the whole private sector. And so we were able to use the data on social marketing organizations to try to estimate a sort of hybrid price within the private sector that reflects the blend of sort of true commercially priced commodities as well as subsidized commodities. In doing this, we found that we had an additional $1.3 billion, which was not identified if we had just applied donor prices across all commodities, which is what was done in the 2016 commodity gap analysis. So in this new analysis, and we look at numbers both on spending and on consumption costs for the public sector, we're valuing all of those commodities at public sector prices. And within the private sector, we're valuing those commodities at this sort of hybrid mix of these via prices as well as the subsidized prices. So I'm just going to walk us through the updated answers to the 4 questions that Nina showed earlier. Here we're looking at results for this full 135 low and middle income countries. In the report itself, all of these results are also presented for the subset of SP 2020 countries. And then as both Nina and John alluded to, that there will be a dashboard launching soon, as well as other materials that will give access to the more detailed results behind this, both at a country level and for regional groupings and other aggregate groups of countries that may be of interest. So our first question really looks at how much is currently spent. So to get to that gap, we first have to understand what current spending is. And as you see here, we estimate that currently about $2.55 billion in total is spent on contraceptive commodities across the 135 low and middle income countries, and that the bulk of this, about 82%, is coming from individuals who bought supplies within the private sector. So 2.09 billion of that total spending. We have about 10% coming from donors, 267 million, and about 8% coming from governments, about 196 million. So as we move from looking at what is spent to how much will need to be spent in future years, the first key to that is to understand how many women are using contraception now and how many will be in the future, and what methods they're using, since the methods they use really drive what commodities are consumed and ultimately the cost. So we see that overall, we expect a gain of about 31 million contraceptive users over the next 3 years, moving from 461 million to 493 million. But not all methods gain equally. And what we see is, in fact, that at this global level, recent trends suggest that it's likely that pill and IUD users will actually go down in absolute numbers as women switch between different methods. And we see growth in all of the other methods. So again, even within these methods that are growing, the growth is not equal. Some are growing at faster rates than others. And from these users, we are then able to estimate the volume of contraceptive commodities and supplies that they will consume, these figures at the bottom. And these represent the commodities and supplies that women need each year, or here cumulatively over the 3 years of 2018 to 2020, to be protected for pregnancy. So for short-term methods, this is accounting for the fact that women need multiple supplies over a year to be protected. And for the long-acting methods, it's accounting for the fact that only a subset of those who are using an IUD or an implant in a given year will actually need to receive a commodity, because some are still protected by methods received in previous years. Again, here we're just looking at sort of the headline results, but these are also available in more detail, looking at each year and looking at these different subsets. So once we have the volume of supplies, we're then able to value them using this hybrid of prices of the public and private sector based on where women are getting their supplies, and able to then estimate what the total consumption costs are. You see that they're estimated in 2017 to be about $2.76 billion, with this expected to increase to $2.84 billion by 2020, so an increase of about 80 million over that time period. And if we were to add up the cumulative cost, because these costs have to be spent again year on year, and so it's important not just to look at the annual cost, but how that is additive across the years. That is 8.45 billion cumulative consumption costs over 3 years, so quite a large figure. And then finally, as the report is called a gap analysis, clearly one of the key things that we want to look at is how that consumption cost compares to current spending on contraceptive commodities and supplies, and to what degree we see a funding gap, how big that gap is now, and how much that gap will grow into the future. Because we know that as the number of users continues to grow, so will the consumption cost. So the cost will continue to diverge further from current levels of spending. So we see that even in 2018, we expect that there's already a gap, that there's already a need for more spending than in previous years. That will emerge to be around $238 million. That will grow to $290 million in the year 2020 alone. And that gap just over 3 years will be $793 million. If we look in this box below, we can see that if we distributed that gap based on the current share of spending of each of these 3 groups, donors, governments, and private sector individuals, sort of how we would allocate that gap across the 3 groups. So we see that for donors, that cumulative gap over 3 years would be about 101 million. So on top of current spending levels, so there would have to be 101 million more spent to keep up with the growing commodity needs. For governments, that figure is slightly lower at 68 million. And for private sector and individuals, quite a large number, given that they are the largest share of the spending at 632 million. So that's the update on the 4 questions that framed the previous gap analysis, and that we then looked at updating in this analysis. And as Nina said, given the current situation and concerns about donor funding either stagnating or even declining, we thought it was important to push beyond those 4 questions and to ask ourselves some new questions, or at least to start to probe some discussions around these issues. So the first thing that we wanted to look at is exploring more in detail where women are getting their methods and what this might mean in terms of availability and capacity of both the public and private sector to potentially serve more women, or to potentially serve a different mix of methods than they are currently providing. We know that others have looked at this type of an analysis in the past. Work by the Shop Plus Project and other colleagues has really delved into this data. But here we've just sort of brought it together in the aggregate to help inform some of these discussions at a more global level. So what you see in this graph is for each method, the share of women across the 135 low and middle income countries who got that method in the public sector in the darker coloring on the left versus the private sector in the lighter coloring on the right. And what we see is that there's a general pattern, which makes sense, that methods that require a service, such as long-acting and permanent methods or an injectable, are more often found within the public sector, while methods that don't are more often found within the private sector, so those short-term methods. So this brings up a question. So if we think that one of the ways to deal with stagnating donor funding is seeing more women seeking methods in the private sector, we really need to think about whether the private sector has the capacity to absorb those additional users, but also whether women would be able to find the method that they are currently using or want to be using within the private sector. So balancing out that idea of sort of women moving between sectors with what methods are on offer and how much capacity there is to provide those methods. And of course, it's not just about availability, but a key piece is also affordability. So whether women who are currently getting methods from the public sector, likely at a free or subsidized cost, would be able to afford their contraceptive method within the private sector. So this is a very first look. We look forward to getting feedback from you all today and to continue to engage in dialogue around this. But we wanted to start to illuminate this question by looking at this issue of poverty. And so what we have done is we've estimated the share of users who are living above or below the extreme poverty line as defined by the World Bank at $1.90 per day. And what we find is that in this global picture of 135, about 11% of all users are living in extreme poverty. As we dig down into smaller regions and subregions, of course, this varies greatly. In that 135 picture, we're sort of hiding a lot of variation. So we are able to look at areas of the world where there's a much larger share of women or users who are poor, and can think about how we can use that to inform where we really want to ensure that subsidized or free services continue to be available to those women. So if we look within that group, we find that of those poor women, about 75% of them obtain their method from the public sector. So we see already the public sector playing a really large and critical role for women who are living in extreme poverty. So extreme poverty was sort of a starting place. We know that there's women who live above this poverty line who might still be unable to afford contraception in the private sector. So we kind of see this as a starting place to think about this, but by no means saying that this is the only thing we should look at when thinking about affordability. And as you can see in the final graph at the bottom there, that we do have some women, that kind of little dark 3% bit at the bottom, we have some women below the poverty line who are already accessing services within the private sector, though a much smaller share than within the public sector. And so also want to be able to have a better understanding of where and how that is happening, and to what degree those women are able to afford those services, or perhaps getting some sort of subsidy to be able to have that access. So this was a brief overview. We wanted to make sure on this webinar to leave plenty of time for questions and discussions. Again, here today, we focused on the results for the 135 low and middle income countries, but welcome you to download the report, which has all of this data presented as well for the 69 FP 2020 countries. And very soon to be able to look at our online dashboard, which will let you explore these analyses at a more granular level of countries and regional groupings. This report has been an iterative process. Each report has sort of led to new questions, which has led to new analyses and more work. After the 2016 report, one of the big probing questions that we had was this nuance of the public and private sector and this question of price and affordability. And so some of these new analyses that we've just shown were our first attempts to explore those questions further. And we look forward to getting feedback and input on what we should continue to probe and explore in the 2019 CGA. So with that, I will wrap up and pass it back over to John to open up for some questions and discussion.
Great. Thank you so much, Michelle and Nina, for that excellent presentation. We already have a few questions that have come up in the text box, so I'll start with that until I see some hands being raised. And the first question is one that sort of kind of says basically they understand that we were not able to include this in the modeling, but it's also good to be aware of how new and underutilized methods will change the method mix. You know, for example, hormonal IUD. Did the methodology, can you say something about whether the methodology took into account, for example, the introduction of Cyanopress? I guess, Michelle, maybe you're the one who's best positioned to answer that.
Yeah, so for this modeling, and again, partly because the scope is really this global picture, we're not really able to account for a lot of those nuances at individual country level or kind of future plans of different specific method introductions. So within the methodology, we do project shifts in method mix over time. So we don't assume that method mix is static, but those shifts are largely informed by recent trends. And so we're sort of projecting out recent changes that we've seen within method mixes happening in countries and in regions, and assuming that those will sort of continue over the short term. So we, within that, we see, you know, recent patterns, especially in sub-Saharan Africa, growth in injectables and implants, for example, and so project that to continue, but wouldn't account for, say, a kind of large shift in the role of IUDs if that was expected to happen as a result of a hormonal IUD being introduced widely.
Great, thank you. There's another question that's come in, and this is one I think we were sort of expecting we would get questions on, and this has to do with a source of public versus private sector data. And can you say a little bit more about the sources of the different data that were used to distinguish private and public?
Yeah, so we are primarily reliant on DHS data for this, which asks women about where they got their contraceptive methods. We know there are some limitations to that because there are some sort of blurred lines within sources of where women are going and what that might mean, but have tried to sort of account for those differences as much as possible. But then we did also integrate in this data on social marketing to try to better account for that piece of the market that might not be well represented within those DHS reported sources. So trying to get an understanding of to what degree the social marketing share of the market is sort of playing a role within that.
Okay. I mean, there also, and I can see right here, there are a number of questions coming in right now on this distinction between public versus private. So maybe I'll just keep pursuing that, and then we can switch to some of the other questions that have come in earlier. You mentioned at the beginning that the public and private sector figures are not directly comparable because you're looking at commodity prices, you know, to governments versus out-of-pocket spending. But the analysis still presents the results together and seems to suggest that the vast majority of the market is served by the private sector. Did you consider looking at the public and private sectors separately?
John, do you want to speak a bit to that, of the kind of desire of the global scope and understanding paying? And I can then add a little more from a more methodological perspective. Yeah.
I mean, I think certainly speaking from our perspective, we, you know, and I think Michelle mentioned this early on, what we were looking at is effectively the barriers to use. And certainly from the country perspective, from public sector and government perspective, the barrier to use is the cost of the commodity to them. They receive funds, they receive either budget line items for commodity procurement or donor allocations for commodity procurement. And the bottleneck, the barrier to accessing supplies, is the price of those supplies. When we looked at private sector, again, as you had mentioned earlier on, it combines a number of costs, not just the cost of the commodity to the distributor or to the importer of the product. There are also transport costs and handling costs and everything else that contribute to the final product price that the consumer buys. But ultimately, the barrier to use, the barrier to accessing that supply in the private sector, is the cost to the consumer. And so to the extent that what we were looking at in this analysis are the barriers to use, we treat the two as comparable in terms of barriers. Although we're very much aware that what's contributing to each set of costs is very different. I don't know, Michelle, did you want to add to that?
Yeah, so the other thing I would add is, I think, as John said, that there was sort of a purposeful blending of these two costs, even though recognizing that, they're not directly comparable. But even if we were to value all of the commodities in our analysis at a single unit price, so if we were to apply that donor price across all of the private sector spending, as we did in the 2016 CGA, we still see this very large share of the market happening within the private sector when we look from the perspective of cost as opposed to users. And that's largely driven by what methods women are getting in the private sector, that those are methods which require a lot more frequent resupply and therefore have a lot more costs associated with them. And so I think, in applying these differential prices maybe further pushes that picture. But I think even without doing that, we already see that there's very pronounced differences between the sort of burden of users versus the burden of cost, really driven by those differences in consumption needs and then the prices of those different products and supplies. And so I do think that there is no matter how you value it, there is truth in sort of the large size of the market that sits within the private sector.
Great, thank you. Another question that came in was asking, is there scope to develop a methodology to help individual countries understand their specific gap and the link to the GFF or other mechanisms to address that gap? Do you want to say something about that? I know this is an issue that we've been quite careful about when we deal with individual countries, because often when we're dealing with individual countries, this is where we start getting into the sort of dichotomy between consumption costs and procurement costs. Do you want to say something more about that? I don't know, Michelle, Nina, either of you.
Yeah, sure. So I think there's a few different pieces. One is I think that we want to be careful as sort of a global report of what we say about an individual country's gap, right? Because we've clearly developed a methodology and approach of estimating consumption needs that might not take into account some in-country nuances, right? So if a country is planning to introduce a new method, as we talked about earlier, or to see a new task sharing policy, which they think will really have an impact on their method mix, our analysis isn't able to take into account that type of nuance. And we also feel that in this global space, it's not necessarily our place to be stating what an individual country's gap may be. We also, at the country level, the data on spending, the quality varies quite a bit. And so at a global level in these aggregates, we're more comfortable with it because especially for some of the very large countries, we have data that we think is a lot more reliable, right? So in that aggregate, we think our numbers are fairly robust. But at a country level, because there's this variation and there's more gaps in the data, it's also harder for us to sort of reliably talk about. We've made available the data about the user trends and the commodities and the consumption costs at a country level, but not gotten into the gap itself. Though, I think that data on its own can be useful for countries to then look at their own budgets, look at their own procurement plans, and think about how that relates within a country.
And I would just add that this is why we try to be quite explicit in all of our materials that we're talking about the consumption quantity or the consumption cost of supplies, rather than say what a country needs, because we're specifically looking at the amount of supplies a user requires and not those larger quantities that must be needed to stock every service delivery point or have everything at optimal levels throughout the supply chain. So we chose a variable that we defined quite strictly and keep to that. So we don't want to confuse people when we talk about these numbers at the country level into thinking that that's all the money that a country will need, because that's all the supplies that a country will need, when what we're talking about is something really quite specific.
Great, thank you. And I think that, in fact, also answers some of the other questions that have come up during the course of discussion so far. Let's see if there are any others that have come through. There's one question that just came through, and it said that, and I don't know, I guess maybe it was Michelle, you had said that the new private sector data uncovered over $1 billion in hidden spending. Can you say a little bit more about what that means?
Yeah, so this is essentially the difference between if we took all of those volumes of commodities consumed within the private sector and valued them just at donor or public sector prices versus valuing them at these new blended prices, which bring together the data from IQVIA about private sector prices with this sort of hybrid approach to account for the social marketing and the subsidized. And so that number is the difference between if we had simply valued all of those supplies at that, in most cases, not always, lower public sector costs versus valuing it at this new cost, which we think better represents the true cost and spending within the private sector. For users who are getting their supplies from the private sector.
Okay, great, thank you. Another question that's come in, has to do with the sample of countries that we're using. And one question is asking about larger countries. And do larger countries like India, for example, and Indonesia, do they skew the analysis? Can you say a little bit more about that?
Yeah, so those countries are in there. The one exception is that we did make a decision to exclude China because clearly its very large numbers are going to have implications, and there's not a lot of data availability to really understand what's happening within that market. We also this year excluded Venezuela because we had gotten some price data from them, but given the kind of current context within the country and what's happening, there was just a lot of uncertainties in that market. So those two are excluded. Other than that, these other large markets are in there. But again, through the dashboard, you'll be able to look at results for smaller subsets, so sort of taking out influence of those countries potentially. But from a global perspective and thinking about the market, I think including them is not so much skewing the results, but really giving a better understanding of what that global market looks like. Since in those large countries are home to so much of the global consumption that they're a really important part of understanding what that whole market looks like.
Great. And also, I think, no, that's great. But I think also, I just wanted to reiterate the point that you just made, that in these more focused analyses, when the dashboard, for example, is online, it will be possible to select a sample of countries and exclude or include whichever in the sample someone wants. And certainly in the case of Latin America right now, we're doing 2 analyses that look at South America minus Brazil and Central America minus Mexico, because those 2 countries would tend to skew the overall mix. So really the data can be analyzed, including or holding back on whichever countries we want. Another question we have here, again, is looking at the role of social marketing organizations. You account for SMO spending by using some public sector pricing, but does the donor spending include contribution to SMOs for commodity procurement? In other words, is there any overlap there for SMOs between the 2 sectors? Maybe you can discuss and share a little bit more about that in the way SMO costs are informing both public and private sector costs.
Yeah, so there's definitely a bit of a gray area here, and we're a little bit limited into visibility of exactly where these costs go based on sort of what data is available. Within SMOs, also there's variation to what degree the commodities being provided through those SMOs are donor funded versus funded by the SMOs themselves. So we have that blend happening. So within the consumption costs, to the degree that we think we're correctly identifying the source of those SMO commodities as the private sector, we're only really counting them once. The place where we might have a bit of blending is when we're looking at our current spending and being able to maybe allocate a bit of that money that's currently on the donor side over to the SMO side. We've looked into this, and we think that the overall share of that whole pot of donor money that's going to SMOs is fairly small, and so that there might be a slight bit of overlap between those 2, but we think it's small enough that it's not really skewing the results, and that it's sort of the best we can do given the granularity of the data that we have.
Thank you. Another question that's just come in has to do with the dashboard that will soon be online. And I don't know if you want to say something about the dashboard, particularly with respect to the information that is going to be available under the 2 kind of entry portals to the dashboard, the individual country level or the pre-selected groups of countries. Would you like to say a little bit more about that?
Sure. So when the dashboard is live, you'll be able to go there and choose from 2 different formats for your information. There's the section for preset groups of countries. So, for example, a particular region or sub-region, or a group of donor priority countries, possibly just all low-income countries. And what you'll see will be results that cover all the main aspects of the CGA 2018 report. So you'll see estimates for users and consumption quantities and costs and gaps and some additional analyses. And similarly, but not exactly the same, if you go to the view that supports individual countries or a bespoke group of countries that you yourself choose, you'll get a view that has that does have the estimates for the number of users and the patterns of consumption, the method mix, and some additional features, but it will be missing some of the things that you have in the country group view, like the gap amounts and some of the spending estimates. So, and then behind that, we'll also have places where you can find additional information, links to the report, links to the various fact sheets. We'll, of course, have the webinar information up there as well. So hopefully we'll be able to uncover some of this richness of all the different estimates that are made that are currently not visible in the printed report, so that you can find the information that's particularly useful to you.
Thank you. And my understanding as well is that the decision not to have the gap identified in the case of individual countries is to avoid situations where, for example, countries may, have procurement costs and have estimates based on what they feel their programmatic needs are that could be at odds with what the demographic data shows would be required to fill that need in a particular year. And so the desire is to sort of avoid that conflict. So when it comes to individual countries, we will not include that. Is that right?
Right, and I think this really speaks to the distinction between what we're talking about in the CGA report and say the really important work that's being done by the CSP group, which is looking at immediate funding needs to keep programs going, which is considering a whole bunch of additional factors that we explicitly don't consider in the CGA analysis, where they're looking at total supply chain needs and programmatic factors that we don't get into in the CGA because we can't do it in a way that's comparable across countries. And so we think it's better for us to just not create any confusion and leave the individual country spending and funding needs to folks who are looking in a more detailed way at specific country needs.
Great, thank you. I still don't see any hands up, so people, I guess, are preferring to condense their questions into short sound bites, which I'm happy to continue reading, but I do encourage some people to raise their hands to add some additional voices to the conversation. Here's another question that's come in. If public sector funding declines, can governments shift users of the most expensive methods to the private sector so they serve more women who use less expensive methods? Wouldn't that help make the donor and government dollars stretch further? I don't know, Nina, Michelle, do either of you have a view on that?
Yeah, I think that for us, the report is posing a series of questions around that, but not necessarily the answer, because I think that answer is going to vary depending on the country and the context and a lot of other pieces. I think what we would probe in that is to think about what do those more expensive methods look like, and what is both the availability and affordability of them in the private sector, and that in some contexts that type of shifting might be more feasible and possible than in others. And so I think that while it's important to consider that, I think that the feasibility of that happening is really going to vary depending on what methods women are using and to what extent the private sector might be able to provide those methods and provide them at that scale, right? So in a country where the private sector is quite small, it might not be able to absorb a large flow of women from the public sector, and so thinking about not just what's available, but also the capacity and the size of the private sector.
And in addition to that, the price in the private sector, because, you know, we can't really say that, well, this method costs this much in the public sector, and therefore let's have these women pay that to obtain it from the private sector, because the price in the private sector might be exponentially higher. So what they would actually be paying would be a lot more. So these are all factors that we're trying to explore and we'll look at in the next report.
Great. Thanks so much. Well, I think we've run out of questions. I think we've covered all the questions that came in, or managed to be able to group questions together. I don't think there are any that we weren't able to answer. So unless anyone wants to raise their hand and ask a question, I think we've pretty much come to the end of the hour. I'd like to thank everyone for having joined the call. Thank you, Nina. Thank you, Michelle, for having given an excellent presentation. For those of you who speak Spanish, I welcome you to join the next webinar that will take place on July 10th, that will focus on Latin America and the unique and challenging constraints that are facing that region. And then later in July on the 24th, to look at ways in which the data that's available can be used by advocates. And by then, the dashboard will be up and running. So I think we'll have an additional source of information. So I think that's it. Again, thank you very much, and thank you, Sophia, for organizing the call. And thank you, everyone. Goodbye.
And yes, this webinar has been recorded and will be shared. I saw somebody ask that. So,
great.
Yeah. Thanks so much, everybody.